want to thank you for coming out and joining us at the end on Saturday. We will have reached 60 hands off our healthcare events in the state of Arkansas. And I just have to tell you, you do not disappoint when we come. Thank you so much. As you all know, 12 days ago in the middle of the night, the House passed a 1,900-page mandate-laden, tax-heavy bill, which Congressman Berry and Congressman Snyder voted yes on. With 10% unemployment across our nation, which is expected to rise, this government bureaucracy creating tax-raising monstrosity is absolutely the wrong prescription for our economy and our recovery. Studies show that in the last 7 recessions, small businesses have led the way out of the recession. So I ask you, why are we passing a bill that will not actually accomplish true health care reform, but will only accomplish taxes and mandates that fall disproportionately on small businesses? The CBO estimates that over 6 years, businesses will pay $135 billion in penalties for not being able to meet up to the standards of the new government qualified plans. But not to be left out or outdone, Senator Harry Reid last night introduced a bill with 2,074 pages, 371,000 words, 183 references to taxes. According to the CBO, which we know is an underestimate because of the counting schemes, even by CBO standards, we'll spend $848 billion and have $436 billion in cuts on Medicare and $486 billion in new taxes in a recession. They say the only place in our country not experiencing a recession is in Washington, D.C., and I believe that. Because only in Washington, D.C. are these bills called moving in the right direction. I happen to believe that it's not just because they're not experiencing the effects of the economy, but it's because they don't live in the real world. They live in a world where they print money or they receive magical money from our pockets, and they're allowed to pass legislation that they're exempt from. And if we choose not to participate, we go to jail. The chances for these bills to actually accomplish true health care reform, because nobody here disagrees that we need to contain cost in the healthcare system. We need to increase accessibilities. But the chances for these bills to accomplish those things are about as realistic as the 48 jobs created in non-existent Arkansas congressional districts that cost us $24 million. These bills will not only flatline our opportunity for a recovery in a recession, but they are bad for patients. And somebody who knows a little bit about nationalized health care is our next speaker, Shawn Danko. Shawn is a small business owner, and he is a Canadian citizen working toward his American citizenship. So let's give him a warm welcome, Shawn Danko.
Thank you, Teresa. Wow, this is incredible. Awesome. You guys rock the house. Yes. Fantastic. Amazing. That is a wow. Woo. Yes, it is true. I am a Canadian citizen, and I am proudly working towards my American citizenship right here in the United States of America. I'm proud. All right, this whole healthcare debate, it hits awfully close to home for me, and it sounds very, very, very familiar as a Canadian. I get often asked, what was it like to have lived in a country that has free healthcare? And I have to pause every single time. It is anything but free. Canadians pay a disproportionate amount of money in terms of taxes. In the province of Quebec, where I'm from, your first $38,000 is taxed at a rate of 28.5%. It's 28 on your first 38. If you make a combined household income of $126,000, you are taxed at a rate of 48.2%. That is 48.2%. And that doesn't include the 13% sales tax. So what does that mean? What did that mean for me coming to the United States? That was an increase of $313 every other week in my pocket. My pocket. I get to choose what I could do with that $313. And some of you would be saying, well, didn't you have to pay for health care here? Well, yes, that is true. But I also paid in Canada for a supplemental insurance plan, which paid for dental and vision, and then also helped pay towards co-pay, hospital upgrades. And it offset each other. So the supplemental insurance I paid for in Canada was offset by the insurance I now had to purchase in the United States. Over the course of 1 year, that was an $8,000 pay increase just by crossing the border. $8,000 in my pocket. So in Canada, not only do they make you pay dearly for your health care, but they also make you wait for it. This is an example in Ontario. An MRI that we so often get very quickly within 24 to 48 hours here in the United States. Average wait time, 110 days, folks, in Ontario for an MRI, 110-day wait. Knee replacement, 184 days. Hip replacement, 158 days. So now we make you pay in Canada and we make you wait. Finally, as a small business owner, my wife and I own a restaurant in downtown Memphis called the Kooky Canuck. Funny name, Kooky. And we employ 55 people. And for the first time in almost 5 years, my wife and I are sitting at home extremely worried. We're worried about the language that is in this healthcare reform bill. And that is the possibility of having to pay an 8% payroll tax on our total payroll. And that represents $40,000 a year off the bottom line, folks. $40,000 a year we got to go find. And how do we find it? Where are we going to find $40,000 a year? We either have to reduce the payroll, in other words, let people go, reduce the benefits that we currently give. We're trying to help our folks out, and we're trying to pay for health care already. It may force us to let that all go. And it also will drive up prices, or all three. I'm not closing my doors, folks. I'm not. So I'm counting on you. As a person that does not have a vote in this fight, I'm counting on every single one of you to voice your opinion, to let your representatives know, and keep up the fight, folks. It's not over yet. Keep up the fight, please.